Ibuprofen is an analgesic, meaning it relieves pain, and it's an anti-inflammatory, meaning it suppresses inflammation, and it's an antibiotic, meaning it suppresses fever type of medication. And here we will talk about what this medication does to your body. So when the ibuprofen is taken orally, first it would go through the mouth, then into the pharynx, then the esophagus, and into the stomach, and from the stomach it would go through the intestine where it gets absorbed into the blood. And from the blood it would get distributed into the body tissues. Now when it reaches the body tissues, it would work as a cyclooxygenase enzyme inhibitor. Now to simplify this, the cyclooxygenase enzyme help in the production of prostaglandins. And the prostaglandins are hormone-like molecules that have many functions, including mediating the pain sensation and mediating the inflammation and fever. So by inhibiting the cyclooxygenase enzyme by the ibuprofen, this means that there is less prostaglandins produced, and this means that there is less pain, less inflammation, and less fever. And by that, the ibuprofen achieves its analgesic, anti-inflammatory, and antibiotic actions. And after that, the ibuprofen would get metabolized in the liver, and then it would get excreted by the kidney through urine. Now comes the question of what could go wrong during all of this, or what are the side effects of the ibuprofen. Now, side effects include gastrointestinal bleeding. And to really understand how the gastrointestinal bleeding occur, we have to go back to the prostaglandins. So we mentioned that the prostaglandins mediate the pain sensation, they mediate the inflammation and the fever. They also have another functions, including they mediate the production of the gastroprotective mucus. Now, the gastroprotective mucus help protect the stomach from the gastric acid. And if there is less mucus produced in the stomach, this would lead to the stomach being vulnerable to the acid, and it would get damaged by the acid and it would bleed. And since the ibuprofen decrease the levels of the prostaglandins, this means that the ibuprofen also decrease the gastroprotective mucus, and this would increase the risk of the stomach being damaged by the acid, and this ultimately increase the risk for gastrointestinal bleeding. Now, another side effect of the ibuprofen that it has a negative effect on the kidney, and this also is related to the prostaglandins, because the prostaglandins have a vasodilatory effect on the kidney vessels, meaning they increase the blood flow to the kidneys, and by inhibiting the prostaglandin production by the ibuprofen, there is vasoconstriction of the kidney vessels, meaning there is less blood flow reaching the kidney, and this means a negative effect on the kidney and a damage might occur. Ibuprofen also has a negative effect on the blood pressure, and this is also related to the prostaglandins, because prostaglandins help controlling the blood pressure, and if there is less prostaglandins, there is less control over the blood pressure, and there is high risk for hypertension. And ibuprofen also has a negative effect on the heart and on the liver. It may lead to hepatotoxicity, and it may lead to a skin rash, which is allergic in nature. And with that, we reach the end. Please give us a like.